After visiting the hospital as a patient, you may be asked to fill out one of those surveys about your experience, but did you know that those scores can affect doctors' pay?
But there's some concern that pain management ratings can put pressure on doctors to prescribe more painkillers. News 8's Madeline O'Neill is here with more on how local hospitals use these surveys.
Martha and Mike, both Mayo Clinic and Gunderson Health Systems administer a national patient survey called HCAHPS, which gauges the overall quality of the patient's experience from staff communication to hospital cleanliness. But one area in particular, pain management, is causing concern nationally.
It's an opportunity for us to see how we are performing in our patient's eyes.
As a doctor, providing quality care to your patients is vital.
Surveys drive what we do in this organization.
Surveys like HCAHPS ask patients about their experience, including if they believe their provider adequately addressed their pain.
When we're measuring satisfaction or how well did that patient feel about the care they received, there's lots of things that they could expect that they won't get. And narcotics would be one of those things.
Since high survey scores can be a financial incentive for physicians, including at Mayo and Gunderson, there is worry that doctors could prescribe more painkillers to please their patients and get a good review. But according to a business intelligence specialist at Gunderson,
However, our primary focus is on how we use that information for improvement.
And he says doctors are trusted to make the right call.
So I have complete confidence that they are providing the best care possible for each patient to the level that is safe.
And as Mayo Administrator Pauline Byam explains,
providing for patients.
Starting this year, pain management questions will no longer be used as part of the Centers for Medicare and Medicaid Services Pay for Performance program.
We still care about patients' perception of how we're treating their pain and addressing their pain goals, but we're not going to tie payment to that.
Byam thinks it's a step in the right direction.
But I do think there's obviously a broader conversation to be had about how we effectively manage and treat pain through other means other than prescription pills.
Dr. Rushlow says that conversation can start by balancing patients' wants with their needs.
It's our job to take those expectations and to teach them what is the most appropriate way to meet their needs. And when we do that, we satisfy our patients.
Medicare and Medicaid will stop paying hospitals based on their pain management scores beginning this October. And nationally, doctors say it's becoming less common for hospitals to base a doctor's compensation on pain satisfaction scores.
Thanks a lot, Madeline. Also, the HCAHPS survey is required for all hospitals that serve patients with Medicare coverage.